Hi guys, the topic that we will be dealing now will be the shoulder joint. The shoulder joint's first type. It's a ball and socket type of joint. It is a multi-axial joint. It has more than 2 or 3 axes of movement. The articular surfaces. The first one will be the head of the humerus, which faces medially and upwards. It is a rounded or spherical structure, and only 1/3 of the head of humerus articulates with the glenoid cavity. And the glenoid cavity of the scapula is the second articular surface. It is a shallow depression in the scapula. It faces downwards and laterally. Another fact is that the margins of the glenoid cavity give attachment to the glenoid labrum, which is a lip-like structure which gives extra attachment to the humerus. And now we move on to the ligaments. The first ligament for every joint will be the fibrous capsule. The fibrous capsule encloses the articular surfaces. And the head of the humerus and glenoid cavity are the two articulating surfaces. And now we go to the glenohumeral ligament. First, it is formed by thickening of fibrous capsule, superior, middle and inferior glenohumeral ligaments are there, and then the coracohumeral ligament. It is formed from the coracoid process of scapula to upper end of the humerus bone. Fourth one will be the transverse humeral ligament. Extends transversely, connecting between greater tubercle and the lesser tubercle of the humerus. The long head of bicep tendon passes deep to this ligament. And now the glenoid labrum. It is made up of fibrocartilage and it is attached to the margins of the glenoid cavity. And now moving on to the coracoacromial ligament. It extends from the coracoid process to the acromion process of scapula. Its point is the coracoid process, the acromion process, and the coracoacromial ligament together form the coracoacromial arch. This prevents the superior dislocation of the shoulder joint. And now we move on to another important 5 mark within the answer, that is the rotator cuff muscles, which is also known as the musculotendinous cuff. It is the most important factor providing support to the shoulder joint. And the formation of rotator cuff. It is formed by tendons of 4 muscles which fuse with the fibrous capsule of shoulder joint. Now, the muscles forming them are the supraspinatus, infraspinatus, teres minor, and subscapularis. These 4 muscles have an abbreviation that is SITS, S-I-T-S, and they're also known as rotator cuff muscles. And now we go to the diagram of rotator cuff. So normally draw the glenoid labrum. Draw the glenoid cavity in which the glenoid labrum must be seen, and you draw the muscles surrounding them, the four muscles: the supraspinatus, infraspinatus, teres minor, and subscapularis. Mark them accordingly, and then you'll have a diagram of the rotator cuff. And here you can clearly see the supraspinatus superiorly, the subscapularis laterally, infraspinatus, and teres minor. And then you can see the fibrous capsule surrounding the glenoid cavity and the articulating surfaces. And now we go on to the relations of the shoulder joint. In this you can clearly see the rotator cuff muscles will be written as relations, along with which the long head of triceps will join the inferior relation with axillary nerve and posterior circumflex humeral artery. And then you can see the anterior deltoid as an anterior relation and the posterior deltoid as a posterior relation. And then the acromion process, the coracoid process, and superiorly, which are connected by the coracoacromial ligament. The coracoid process gives rise to two heads, that is the short head of biceps and coracobrachialis, which act as the anterior relations. As shown before, now we go on to the relations. Anteriorly, we have the subscapularis, coracobrachialis, biceps brachii, and anterior fibers of deltoid. Now moving on to the posterior relations, that is the infraspinatus, posterior fibers of deltoid, and the teres minor. And now to the superior relations, that is the supraspinatus and acromion process. Inferiorly, we have the long head of triceps, axillary nerve, and the posterior circumflex humeral artery. And now we move on to the next topic, that is the movement of shoulder joint. The first one will be flexion, second one will be extension, and then abduction, adduction, medial rotation, and then lateral rotation. And now flexion, extension, abduction, adduction, medial rotation, and lateral rotation. So flexion, the position of arms will be the arms move forward and medially. In extension, the arm moves backward and laterally. In abduction, the arm moves laterally, away from the trunk. In adduction, arm moves medially, towards the trunk. In medial rotation, in semi-flexed elbow state, the hand moves medially. And in lateral rotation, in a semi-flexed elbow, hand moves laterally. And now we move on to the muscles causing these movements. These are very important. So for flexion, it is pectoralis major, which is assisted by the fibers of anterior deltoid fibers. And for extension, it is latissimus dorsi, assisted by the fibers of posterior deltoid. And for abduction, we can change it into three stages, that is 0 to 15, 15 to 19 degrees, and 90 degrees to 180 degrees abduction. For 0 to 15 degrees abduction, it is done by the supraspinatus muscle. And for 15 to 90, it is done by the deltoid. To 90 to 180, it is done by serratus anterior and trapezius muscle. And for adduction, it is done by pectoralis major and latissimus dorsi. Pectoralis major from the front, latissimus dorsi from the back. For medial rotation, it is done by subscapularis. And for lateral rotation, it is done by teres minor and infraspinatus. So if you want to elaborate it more with the diagram to the examiner, it's very simple. Try to draw a person's image from above. And draw shoulders and a head. Make it clear and draw a hand. You must be clear to draw three axes. I'll tell them one by one. So the first axis will be in a hand, which will be medial rotation and lateral rotation. And the second axis will be abduction and adduction, which takes the hand away and close to your body. And then the next axis will be for flexion and extension. And now we move on to the most important part, that's the applied anatomy of shoulder joint. The most common injury cause is the supraspinatus tendon tear in the rotator cuff. And then the dislocation of the shoulder joint is also very common in the inferior direction, because the rotator cuff does not give support in the inferior direction, and the axillary nerve may get damaged if there is dislocation of shoulder. And that's it guys, that's easy anatomy for you. Please like and subscribe if you like the video. Thank you.